Hey guys, Sean here. York Hsiang, a vascular surgeon from the Lower Mainland, was published in the British Columbia Medical Journal this month, and he discusses the problems associated with Bill 36. The following are excerpts from a conversation that I had with York, Dr. Charles Hoffe, and two other independent candidates running. It was filmed in July, so there's a couple things that have changed since then, but I think it's a really good conversation that illustrates what's going on in our healthcare system and some of the problems British Columbians face. Attached also is a link to Dr. Hsiang's medical journal article. Anyways, enjoy. I think it's a really good conversation, and enjoy.
My name's Sean Taylor. For the past 25 years, I've been a paramedic, a firefighter, a soldier, and a registered nurse. I grew up in Vernon, BC. I worked most of my adult life in Alberta, working advanced life support air ambulance all over northwestern Canada, fire rescue up there. I joined the Calgary Highlanders Reserve Infantry Unit in 2002, concurrently while I was going to nursing school, and served in the Canadian Armed Forces for 19 years. I um, I became a nurse in 2005. Started off in pediatric emerge, took some time off of nursing, and went to deploy to Afghanistan in a role of I was working for psychological operations with Task Force Kandahar over in Afghanistan. When I came back from Afghanistan, I transitioned into adult emergency nursing, doing contracts all over in Western Canada. And in 2015, I moved back to British Columbia to be closer with family, where I got a job working with Interior Health. I worked full time in Kelowna for a while, part time in Vernon, Salmon Arm, or not Salmon Arm, Penticton. And I got involved politically on the federal level in 2018 and ended up running as a federal candidate for the People's Party of Canada in South Okanagan, West Kootenay, where I never really spent any time, even though it was just down the road from where I grew up, and kind of fell in love with Grand Forks and ended up taking a full-time job there. And fast forward to the last federal election when we were in the throes of this massive global pandemic, as they called it. The things that I said during the election ended up getting me fired. I've also been kicked out of the army. And after the experiences that I've had, I've kind of dedicated myself to trying to raise awareness to what is going on in this country. And this has just evolved into, I look at this running for as an independent in the Boundary Similkameen riding as just my next form of service. And yeah.
My name is Roger Harrington, and I'm from Penticton Summerland Riding. I practiced dentistry here for 43 years in the Valley, and roughly 2020, when things really started rolling, I participated in the Pacific Dental Conference, and that was one of the primary points where the COVID virus was showing. I think there were reports of either 40 to 80 people who were infected at that event. Bonnie, the College of Dental Surgeons, and the BCDA were involved in making the decision whether to even continue allowing the convention to go forth. And then the following week, Bonnie shut everything down and threw the dentists under the bus. Following that, I got involved with a group of other people who began protesting on Richard Canning's corner on Main Street and Nanaimo in Penticton. And every Tuesday we would be there at noontime, shaking signs and getting attention from the passersby on the Main Street. And I can tell you things were pretty hot. And most of the time, over 50% of the people who were driving by were telling us that we were number one. And as we continued that, over time, those numbers declined. But and then, of course, the vaccines rolled out the following year, And of course, we all witnessed the truckers' convoy. My wife was actually one of the people on ground zero at the time. And we continued subsequently to do a SWOT analysis as a group of about 20, and we formed a riding association. And the riding association asked me to run.
Please.
I'm Corinne Mori, and I'm currently living in Nelson. I will be running for the riding of Kootenay Central, which is a region that I have been living in for the last 50 years. I have experience as a business owner, builder, land developer, and then did my registered nursing training later in life. I worked in rural BC, mainly in emergency home health, and did some First Nations work as well. I discovered that when the mandates came down, that I encountered within myself a dilemma in that we are a profession that is supposed to conduct ourselves by ethical standards, which means the priority is that I have to support and legally ensure that patients have the right to personal autonomy in their medical decisions. I discovered that the way that things were being carried out in this province was violating that. And so I ended up walking away from my job because it was, the compromise was something that I could see was destabilizing what it is to be protected as a human in this country. I ended up paying more attention to local government and have spent the last couple of years monitoring what's going on at the regional district, trying to understand why the taxation rate is so high, and started to understand the legislation that is coming through the provincial levels, which are becoming increasingly restrictive, regulatory. There is this intent now that the government seems to want to take our resources through overtaxation. But at the same time, it's also just increasing the size of government and the bureaucracy that's related to it. We are very much becoming a state that is going to be more of a managerial state than it is a democracy. And if we don't have people stepping into positions of leadership that will protect what it is that we have built in this country, it will disappear.
So my name's Dr. Charles Hoffe. I'm a family doctor and former ER physician, rural country doctor. I live and work in Lytton in the Fraser Canyon, where I've been for the last 31 years. I'm just a rural country doctor that had run foul of the authorities for going public on what the COVID shots did to my patients. So that's who I am.
Great. Hi, everybody. My name is Dr. Hsiang. I was a vascular surgeon at the Vancouver General Hospital for my entire career. I practiced as a vascular surgeon there for 34 years. During that time, I served as the head of vascular surgery. I was also a professor of surgery at the University of British Columbia for the same amount of time. And I chose early retirement at the end of 2021 when it became impossible for me not to be vaccinated and continue my work. And so that's my story in a nutshell.
In the fourth month of the vaccine rollout, I sent a letter to Dr. Bonnie Henry, letting her know about what her shots were doing to my patients, which was not good. That was considered to be misinformation by the college, and I've been under investigation ever since and have a trial coming up. 1 month after that, the college put out a warning to all doctors that if you spread misinformation, and they considered any talk of vaccine injuries to be misinformation. And they warned doctors that if you spread misinformation about COVID or COVID vaccines, you would be investigated and, if necessary, disciplined. So that's, of course, what's happened to me. But what that did is it shut down freedom of speech amongst doctors. It literally created an illusion of consensus amongst the medical profession because they'd been warned not to go against the party line, not to go against the political narrative. Now, Bill 36 puts that into law, where if you speak so-called misinformation, and of course, misinformation is just anything that the government doesn't happen to agree with, you can get a $500,000 fine and 6 months in jail. So we no longer have freedom of speech in medical care, which means you cannot give informed consent to a patient if you can't speak freely about what you think about a certain treatment. So this is a crisis in medical care because doctors have lost freedom of speech, which means there's no longer informed consent, and we've lost one of our charter rights. So that, in a nutshell, is, I think, the biggest problem facing healthcare is this this loss of freedom of speech for the medical profession.
So in the 6 months following all the terminations of the healthcare workers, I, through the Freedom of Information request, obtained information from 4 health authorities, and I asked for all of the COVID sick calls that were initiated by staff. So if you're scheduled for a shift and you can't make it for any reason, you have to call into a specific line and you have to identify why you're not going to be at work that day. And when COVID happened, they made COVID a specific choice. So they were able to distinguish between COVID and other illnesses. In the 6 months after staff were terminated, there were over 20,000 COVID sick calls from double vaccinated staff, just in 4 health authorities. This shows the health authorities knew that there was nothing about this vaccination that was effective. And yet there was this continued move to coerce and control and deliberately remove certain members of the healthcare community out of the workforce to continue to uphold something that was obviously not working and obviously a lie. So when you have right off the bat, your health authorities contributing and cooperating to making sure that the public is not told the truth, how do you know what else is being undermined?
Let me add to that. In the fall of 2021, when vaccine mandates were being forced upon on all the healthcare professionals, the justification in the provincial health office's orders claimed that they had information saying that unvaccinated healthcare workers were potentially could spread COVID to staff and patients. So I filed a Freedom of Information request asking specifically how many staff members as well as patients had been infected by unvaccinated healthcare workers. The answer to that came maybe about 4 months later, when they said that there were no records to confirm this. And so it confirms to me that from the government down to the provincial health officer to all of the health authorities, they have absolutely no information regarding this. They don't have a leg to stand on. What they're claiming is completely false. If they had any cases, clearly they would have pointed that out. And so the narrative here is what? Is to silence people, to force people to take something against their will, to create stories, fabricate this whole thing. It was an eye-opener to me that working in this health authority for over 30 years, I felt that I could trust them. I felt that I could trust my colleagues. I felt that I had a voice. I was a very senior surgeon in my hospital, and yet I was silenced. I couldn't speak up. So if it can happen to a person like me, surely it can happen to you too.
If I had one question to ask these people, because it's not like this is new news, right? Like we've been doing this for a while now, but you look at these changes that were implemented and the lack of questioning, which is what we were punished for questioning these things. Like the first 3 years of my career, I was a pediatric emerge nurse, and now the pediatric facilities across the country have pediatric stroke teams. And I'm like, how do you rationalize that? Like, yeah, there's signs on the buses saying kids have strokes too, but they never used to, right? you look at, you hear these stories about, 6-year-olds having STEMIs, and it's how do you rationalize that? That like this spell should have worn off by now, and here we are in a jurisdiction, the only one in the world that still has thousands and thousands of healthcare workers that are still barred from employment because they didn't want to participate in this experiment. When I think it's not groundbreaking news that this hasn't gone well. I think you could go out on the street and ask just about anyone. It's like, if you haven't taken the vaccine, are you upset you didn't take it? Right? I don't think you'll find anyone that is. Right. And I think if you ask most vaccinated people, they're upset that they took it. If the ones that'll talk to me anyways. Right. So we look and in a system that's supposed to be led by evidence-based practice, where is the rationale for this? Like, it's come out, 2023 was the record year for retracted scientific papers. The amount of bad science that they use to push this through is just, it's comical, really. And the fact that we're still carrying on with this and our government still keeps doubling, tripling, quadrupling down, right? And the people that I used to work with, for those that have been in an emergency situation, like you develop a pretty strong rapport. Like, you love the people that you work with. You're in the front lines, you deal with chaotic, horrific things, and to just to have a segment of your population thrown in the garbage because they looked at things differently, when it's become pretty apparent that our opinions were correct. So I guess that would be my question to people that are still in the system. How do you rationalize where we're at today? Because they keep plodding down this road.
It's been an ongoing question for me, because I talk with some of my peers who are still totally embedded in the matrix, and the conundrum for me is, how do we crack it open? And I'm reading Michael Nell's book right now, The Indoctrinated Brain. And this society, according to Nell's, is showing a lot of hippocampal destruction as a result of all of the stresses we've endured over the past 4 years. And so I'm questioning how we're going to penetrate through what I call the boson, which is it's a term you see on the internet in the Wikipedia. But anyway, it's still a huge question, and I'm wondering, among the group here, has anyone had a satisfactory penetration of that where someone goes, aha?
It is a big question.
I would say that none of my physician colleagues that I had interacted with have come over fully. They have made some suggestions, and I have tried to link their observations to what is going on. And specifically, I can think of 2 examples. One is that when I got together with them, someone made the comment that cancer cases are just at an all-time high. And I would say, why do you think that is? Just to gently probe them, and they would then think about it. And one of the answers was, we can't discuss that. Which I was rather both surprised and disappointed. The other observation that I've come across is that, because of the type of surgery that we do a type of operation to prevent further stroke. It's called carotid endarterectomy, where you operate on the carotid artery in the neck, and that is believed to be the source of emboli or clots going off into the brain. And so a couple of my colleagues have actually commented that the incidence of carotid endarterectomies, surgeries needed to be done to prevent stroke, has dramatically increased over the last 2 years. And I'm trying to get the information for that. There is some information from different hospitals demonstrating that it has increased. And whereas in other hospitals, perhaps the total number of operations has not increased, but the incidence of patients presenting with stroke as a presenting symptom has increased. And so, again, when I ask them about that, the usual answer I get is that, well, we're now a large catchment area. We have a stroke team, but you're still the same hospital. The stroke team is there to look after early strokes. They haven't quite put two and two together, and so I'm still working on that. It's a work in progress, and I keep feeding them articles. Even I would say the Times columnist, you probably saw this maybe about 2 weeks ago, when in fact a reporter is actually coming out and saying, what's going on? We have increased unexpected deaths in BC. When are we going to start looking at this? And I thought that's incredible that a reporter would actually be able to report such a question.
I think that one of the most important questions that we need to ask fellow healthcare providers is why Health Canada, Public Health, all of the health authorities completely ignore the safety signals. With any medical intervention, there is always a risk of harm. That's why we have to have informed consent. There's always a risk of harm it doesn't matter what it is. Even taking an aspirin carries a risk of harm. So the safety signals from the COVID vaccine rollout are amazing. The open VAERS from the US, 37,000 people dead within, suddenly and unexpectedly after their shot. I think it's now 71,000 people permanently disabled. And of course, what people say, well, you can't prove that was from the shot. That maybe that's just 71,000 coincidences. Okay, maybe they are. But if we look at all-cause mortality, the US CDC released a report about 2 weeks ago showing that they have 500,000 excess deaths in children and young people in the US since the vaccine rollout. Now, children and young people don't usually die. It's usually old people that die. They have got 500,000 excess deaths in people under the age of 40 in the US. And if you look at excess deaths in total, it's 1.4 million in the US, it's 3 million in Europe. It's absurd that these safety signals are completely ignored. And so this is the elephant in the room. This is the question that every healthcare provider has to ask themselves. Why does Health Canada ignore the safety signals? And the simple answer is Health Canada gets 90% of its funding from the pharmaceutical industry. Health Canada doesn't work for our best interests. Health Canada works for the pharmaceutical industry. That's who their employer is. So it's hardly surprising that they ignore the safety signals and just look the other way. Just follow the money. This glaring corruption, the fact that, and of course the media ignore the safety signals because they're also owned by the same people that make the vaccines. So these are the questions that healthcare providers need to be asking, because we now cannot believe anything that Health Canada say, just like we can't believe what the journals say because they're also owned and controlled by the same people that make the shots. So we're in a difficult situation as healthcare providers because we have found that all of the people who we thought we could trust have turned out to be completely untrustworthy.
I keep thinking that we're going to have to continue approaching our peers on an individual basis. And it's going to have to be in private, because Bill 36, as Charles pointed out, is the suppression of free speech. And everyone is busy self-censoring because they're afraid that someone is going to hear. And if someone hears, they're going to get reported and face all of the consequences. I think we as a group acknowledge that what's going on is a criminal activity perpetrated by our government. And that's the challenge for us, is to punch through that. And I can't help but wonder if we shouldn't be reaching out on an individual basis, go for a coffee with some of our peers, and not the guys who are in, but the guys who we know. I mean, and I can name a host of them, and just see if maybe after this much time, some penetration can be achieved. Does that make sense?
I was a pretty popular guy at work. I'm a hard worker. I worked all the different shifts. I was senior staff. I mentored new people, right? And when the chips were down, a big trauma rolls in, a STEMI, a hot stroke, whatever, like I was one of the go-to guys. People would come to me for advice on critically ill patients and stuff that was baffling. And, you know, I went out about 8 months after I was fired. I went out for coffee with a friend of mine, and she's like, they still talk about you, eh? Like they hate you. And I just, and I know like Charles, you're still like doing private practice, but like you've been kicked out of the hospital. You're not allowed to practice there. And I don't know who you're talking to, but like no one talks to me anymore. I'll have a couple that I, call up on the phone every now and then, but no one talks. They're under the spell. And watching, people that I worked with and loved, right? They took it. They gave it to their wife. They gave it to their kids. They gave it to the 400 people that they have a fiduciary responsibility to protect. The psychological barriers that exist between them and being able to accept that truth. I'm curious about what the catalyzing event is that's going to reveal this to people, because you'd think like logic would tell you that they'd be seeing it by now. Like what you just said, Charles, is absolutely horrifying. Like these statistics that we're seeing, this is insane. The rise in all-cause mortality, we're seeing 4, 6, 8 sigma events, where one would be like World War II. A 10% increase in all-cause mortality, a once in 200-year event would be like World War II. And we're seeing 3, 4, 5 times that. It's absolutely astounding. It's like, well, where is the voice of reason coming in? Because there's so few of us that actually stood up and were vocal about this, and they absolutely hammered us, right? I'm still being dragged through. You're about to go into the breach. By the way, congratulations. I hear that you got a good decision on Tuesday. Good to hear. But like the lack of a voice of reason from within the system still, at this point, can you expect it to ever turn around?
I think what makes it so difficult for doctors and nurses and healthcare providers to turn around is a lot of people find it very difficult to admit that they were wrong, especially when they were very vitriolic against anybody who opposed it or who revealed evidence of harm or who questioned it. We were hated. And of course, from Trudeau onwards, they worked hard to make us hated. They created medical apartheid. We were the dangerous spreaders of disease that was prolonging the pandemic and creating new variants. I mean, do you remember it all? We were the outcasts that weren't allowed into restaurants and all kind, weren't allowed to travel. So for those people who applauded that to now back down because they're vax injured or their mother died 2 days after her 5th shot or whatever, for them to admit they were wrong takes a bit of humility. And unfortunately, a lot of people just don't have enough humility to come and apologize or to say, I was wrong. I was seriously out of line. I perpetuated that medical apartheid and that division and hatred for the unvaxxed that the media and the health authorities drove that wedge of division to get people vaccinated. There were so many people who got vaccinated just because they wanted to be socially acceptable. And So I think that's the biggest thing is people's egos are so big that they can't, for them to admit they're wrong is a blow to their ego. And some people just can't do that.
I'd like to add to that and say that I think on an individual basis, it's going to be near impossible for us to try and wake up our colleagues because number one, it takes so much time. Number two, you never know if it's going to be very effective or not. I think probably this is all going to come through political pressure. And as an example, one of my friends actually had a meeting with Kevin Falcon yesterday. And one of the things he brought up, he said, you know that the more you're vaccinated, the more likely you're going to get COVID. And Kevin Falcon did not know. And so it begs the question, who is the health critic in that group? And so if the politicians don't know, and you can give them lots of reasons why, they shouldn't be staying on the forefront of this, surely it's the Ministry of Health. Somebody has to have their eye on the ball, and someone took their eye off the ball. And I think that one of the ways that we're going to have to create a change is through political pressure, probably through the opposition government, to raise these type of uncomfortable questions during question period and have the government respond to it. The government is probably going to try and waffle its way out of it and things, but the mere fact is that if you actually say this publicly in the legislature, where it can be watched and reviewed, maybe that is one of our better ways of doing it, a much more efficient way, rather than, as Roger has suggested, which I think is a great way of doing it. But there are 14,000 doctors alone in BC, and I only know maybe a few dozen. And so it's very, very hard to actually convince your colleagues about this.
I'm going to offer the thought that maybe we're just going to have to prepare for impact. The conditions that I'm seeing happening right now is I was listening to the annual general meeting of the BC College of Nurses. And currently they're trying to address the shortage of nurses by bringing in international workers. Now, this is a process that the government is paying for, which they don't cover the costs of their own nurses, but they're paying for the process of the international ones. And they admitted in the meeting that they have never had so many fraudulent applications. So we are bringing into the country workers that there is, and they're also under the stress of having, because the process is expedited now, pressure to get these people in. There isn't a due process being done to really investigate their credentials. So we have this influx of international workers in that we actually don't really know what the level of their skill level is. Currently, we have working in hospitals, like when the pandemic happened, there was a huge exodus of any experienced healthcare professionals that were close to retirement. They left. And I have a family member who's working as a nurse right now. She's 29, been out of nursing school 3 years, and she's one of the most senior nurses on an acute floor in a large Victoria hospital. So we have lost the nursing, like the skill level that was there to actually mentor the next generation. And I've heard from patients that when they're in there, it is scary. They're not, nobody wears a stethoscope anymore. Nobody touches you. Nobody assesses you. There's no one there with a higher level experience that is saying, look, we need to do this better. And so we have the level of care that's been given is deteriorating. We're having massive mismanagement of the finances by health authorities and wasting of money. I mentioned earlier that the Attorney General of BC just put out a report that the whole harm reduction model was significant deficiencies, $2.6 billion gone and nothing to show for it, except that we've tripled the rate of death by implementing this policy. The management that is that is administrating how our healthcare service is going it's a failure. And we are having over 40% of those dollars going into administration and management rather than frontline care. And rural BC is suffering because it's easy to reallocate those resources to urban centers. When I look at the picture that's building, and also now with the Healthcare Professions Act being put through and the control that will be over healthcare professionals, I really don't see that we're going to stop this train. We need to brace for impact. And once that happens, we're not going to know until after that impact what's left or what we have to work with, or even if it's possible that there would be anything to work with. So if that becomes the thinking of how, instead of shifting from, we're going to be able to change things, we acknowledge that that's almost impossible now. What are the strategies for trying to rebuild or reconstruct once something of this magnitude in our society is totally destroyed?
You're all familiar with the fact that the federal government has brought in, or they're trying to bring in, a federal dental program. And I don't know whether any of you have followed it, but financially, it's an absolute disaster. And patients, it gives the illusion that patients are going to get 100% of their fees covered. And basically, the fee structure that is being covered is about 70%. And so it's a bait and switch tactic that the feds are using. Now, the dentists, at least in this province and across the country, have been fee for service, and they practice on a private basis without any government interference. Having said that, they're heavily involved with the insurance companies, but they've retained a certain amount of autonomy. The bringing in this dental plan is a plan by the government to get dentists under the same jurisdiction that the physicians and the nurses and all the other healthcares are. So it's a lure. And so the patients are uninformed. They think they're getting something for nothing. Everyone wants something for nothing. There is no free lunch. And certainly in this province, many of the dentists, the vast majority of them, are standing against it because they see that it will be an attempt by the government to bring us under the same umbrella that many of you are finding yourself under now. So, and I think it's illustrative of how we got there, because I think 30 or 40 years ago, and Charles and York, I'm sure you can address how it was that the physicians were brought in under this bit by bit. And so we're at the tail end of it. I wonder what would happen if the physicians started practicing without the benefit of the colleges and just set up their own licensing body, because Robert Johnson has mentioned that we should just freewheel away from all of this healthcare and begin practicing in a much freer fashion. That may be how we step aside from the impact, Corinne, that you're talking about. Maybe it's when the pieces are all over. This will be what comes out of or is the phoenix that comes out of the ashes.
The problem is part of this very top-down micro-controlling system is that the college, well, certainly of physicians and surgeons, is the only licensing body for doctors in BC. And so if you practice medicine without a license, you can literally be taken to the cleaners. So that is the problem, is that they have a monopoly on this, and they decide whether or not you will have a job or be licensed. I mean, again, that is completely wrong, because now that we've seen how incredibly corrupt they are, the fact that they ignore all the safety signals on these COVID vaccines shows that they are completely dishonest and corrupted. And the fact that these corrupt people have a monopoly on medical licenses, and without their consent and blessing, you cannot provide healthcare as a doctor, is something that really needs to change. Because if they were people of integrity, that might work. But they have unfortunately proven themselves to be very corrupted and conflicted. They appear to be employed by the pharmaceutical industry, and that is the only reason we can think of why they completely ignore all the evidence of harm from the COVID shots.
I was speaking with a nurse that has immigrated here from Germany, and she was telling me in Germany they're not licensed. And I thought, isn't that interesting? Like, if you get credentials, you get education, you get credentials, what really is the requirement to be licensed? I mean, if you get hired, then it should be up to the employer to enforce if you are performing up to your job duties or not. But involving this extra layer, it sort of is obviously something to just create control. The responsibility should be on the educational institutions or the educational systems that we construct to vet somebody appropriately. And if they're given the credentials to function as a physician or a nurse, that is required. And then it should be up to the employer to ensure if you're working up to your standards.
You look at the consolidation that's about to occur, by moving all the disciplinary bodies into 6 colleges, right? And with 100% government appointees. Like, you used to have 50% doctors that were elected by the college, the membership of the college, to serve on the board, and those are going away. Like, this is about total control. And like you showed, Corinne, with the amount of funds that the government gave to the BC Nurses Union, right? Who pays the piper calls the tune. And this, I think what they're doing right now is such overreach that it's ultimately going to fail, right? Like, there's too many people that'll just say this can't go on, and you're seeing a mass exodus. Like, we're watching it collapse right now. Like, I feel bad for people that are waiting for a surgery or get in a car accident and have to go to the hospital. The lack of services are really impactful, and unfortunately, the majority of people don't even know it. That's the thing, because no one's talking about it. It's being kept out of the press. Like, I was having a conversation at work on the construction site that I was working on, and they didn't even know that the Grand Forks Hospital was closed for over 2 years, right? And they're doing these things to keep the lights on and so they kept the emergency open, used it as like an urgent care center. They do the cardiac clinic and the cancer clinic and stuff like that. But if you got sick and needed to be admitted to the hospital, we sent you to Trail, Kelowna, Fernie, and they never told anyone. So the town didn't even know that their hospital was closed. And I think if they did, there would have been more pushback and an uproar about it. But their ability to control the narrative, be able to hide these things from the public, and unfortunately, when the majority of people find these things out, is when they're in crisis and it's too late.
Well, there's one thing that happened to me today. I was talking to a friend who assumed that she had a bladder infection, so she can't get into a doctor anywhere. So she goes to the pharmacist because now they have the ability to dispense prescriptions. I asked her, did they do a dip on your urine? No. So there right now, the move is, okay, we're gonna help the system by giving pharmacists the ability to dispense medications, but nobody's actually doing the test to diagnose that this is really what the problem is. And we know what the issue is with overprescribing antibiotics. And we know that there's lots of things that can contribute to a certain symptom coming, and you can't just assume that it's something without testing. So now the level of care that we're given, it's like, wow, like just in a few years, how much it has deteriorated, and that it's okay, that this is acceptable in terms of the provision of care. And none of these healthcare professionals are resisting or putting up a fight or saying, you can't just give out drugs without, verifying that somebody actually has a specific issue. But this is what's happening.
I'd like to add to what Corinne said. The last time we had an epidemic, it was known as MRSA. And MRSA, in fact, was imported from other countries where pharmacists call the shot. And so the pharmacists have all the antibiotics, and patients go to the pharmacist to say, how would you treat this infection, blah, blah. So the pharmacist just dispenses what he thinks is appropriate without doing any tests, obviously. And then a day later, the patient comes back because it didn't help. And then the pharmacist says, I've got a different antibiotic for you. And so you get on this merry-go-round of different antibiotics and you create superbugs. And that's how we imported MRSA as a superbug, and it hit we had to change our practice of surgery because of MRSA. We had never seen this type of flesh-eating disease that would eat through your wounds, eat through your grafts. These grafts would explode on the ward. People were hemorrhaging, and so it was a disaster, absolutely. And I think what Corinne says is that if you now give someone without training the ability to prescribe drugs, which was previously restricted only to people with training, what do you expect will actually happen?
York, I need to correct that. The pharmacists each had 45 minutes of online training in order to be able to prescribe 20 different things. So they have had training, but this simply indicates how absurd this is. I mean, this is just medical care going into a deep hole. That kind of sums it up.
And we've seen with the Health Professions Act that have been on the books for a while now, the deregulation of scope, right? Where you can just like, well, it'd be nice to have a doctor to do this, but we can get a nurse to do this. We should have a nurse to do this, but we can get an LPN to do this. And you look, there's been like when I spent most of my practice time in Alberta, but yeah, like you have med administration courses for cooks and stuff like that and servers in old folks' homes, and they were just getting rid of educated people to do things anywhere they could. And it's a stopgap, right? So you'll see more of this, and you'll go in to see someone that you think you're going to go see, and you'll get referred to another type of employee.
It's tragic to see a wonderful healthcare system literally spiraling downwards. It is very disappointing. But yeah, one wonders at what point the public realizes how much trouble the healthcare system of Canada is in. I don't think most of the public realize that the 3,000 healthcare workers that were fired for refusing the jabs, and the many, many more thousands than that just took retirement rather than get fired, are just part of the problem. And I don't think most people realize how blatantly dishonest the vaccine mandates were. I mean, the vaccine mandates were based on pure lies. And the biggest lie was that by being vaccinated, you could keep other people safe. It was absurd. I mean, it was the exact opposite. The more vaccines you have, the more you'll get COVID and the more you'll spread COVID. But most people still don't even realize that. And so they don't realize that the fact that their emergency room is that they've now got an 8-hour wait, or it maybe is even closed, is because of this absurd, dishonest public health policy where the patients are the big losers. It is tragic. Lab techs and other people who went to other provinces because they got fired from their jobs in the hospitals here, this is a man-made crisis. And the fact that they are now employing these ill-qualified foreigners to replace the best of the best, the people who had critical reasoning skills, the people who had the most scientific knowledge, that got fired, the people who could see the logical absurdities of the public health policy, have gone elsewhere. They're doing different jobs or left the province, and it is tragic. So the big losers are the patients. And unfortunately, because the government controls the media, people don't know that. So we're in a tragic situation, and I don't know how we break out of this malaise, this delusion that people still watch their television and still believe Bonnie Henry and Adrian Dix and Justin Trudeau. I mean, that have been proven to be so dishonest and so unreliable.
I was in New Denver a couple of weeks ago. There was an anniversary there for the Nikkei Center, which is a museum of sorts that was built to honor the Japanese that were interned during the Second World War. And I was looking at some of the history around this. It was like 1941 that the BC government forced natural-born Japanese Canadians to sign a form that they were enemy aliens of the state. The following year, they took away their newspapers, they closed down their schools, they confiscated their assets, and then they sent them into internment camps, which means to confine, sold their assets. That was 1943. 1949 was when they were given back their rights to be Canadian citizens, to be able to move through the country freely, to be released from the control of the government. And I look at humanity always seems to follow these same cycles. These are characteristics that we have had in us from the beginning of time, where injustice will occur, and it occurs because people stand around and watch. They don't intervene. But somehow I think we're in that same cycle between what was 1943 and 1949, where there was a shift where people who were being abused and overruled by the government, something shifted to correct what happened. And they were able to at least restore humanity back to these people. We're in the same place right now. I don't know that we will actually have the same outcome. We have the same characteristics. There was abuse from the government to a people group. It happened because people stood by and watched. We're in a place now where there's finally, the lights are going on, that something happened that shouldn't have happened. But what we're trying to see is if within the human race at this point, if we can somehow summon that spark of still showing what the divine nature looks like, which is understanding concepts like justice, understanding what do we have to do to rebalance things that have been out of balance. And we're at this place. So we're going to see if we're going to have an impact. The reason why this is even happening is because people like yourself have been stepping up for the last few years, calling to attention, look what happened to us. Is this the kind of human that we want to be? What do we want to pull out of this? How can we move forward? And those voices are rising. That's what gives me the optimism, just because there is this vibration that is coming across our province where people are saying, no, we know right now, we know we have to do something. We have to do this now. And so there's this sense of responsibility. It's being resolute. We're not here because it's fun. We're here because it just has to be done. It just has to be done. So we're at least cooperating with each other. We're showing actually by our collaboration together and our coming up with ideas, and that we are respect and honoring one another. We're exemplifying that it is possible to have good leadership, where people are trying to make decisions in your best interests, and they're willing to hear other points of view and try to discuss topics that it's like, how do we come to a decision that will actually benefit us? And so while we're in this process, we are actually trying to example to others what that's supposed to look like, so that you can tell the difference between a good leader and a bad leader, because most of us didn't really see it. And now we do. So we're a little bit more equipped, we're a little bit more educated. Now becomes the step where we have to become empowered. And so this is right now the transition that we're in.
You know, when I look around at the faces in this room, I don't think it's an accident that the three independent candidates here all come from a healthcare background. What we've gone over, what we've gone through for the last few years, there's been a distillation process. And, you know, the people that share this room with me, the names that we know across this country, they've risen to the top, they've shown their integrity, and we're going to forge a new way forward in spite of what's going on. I'm just excited to be a part of it. And, you know, I think we need to bring this fight to bear on all these fronts. And for me right now, that's in the political front. So, yeah, thanks for your time and look forward to seeing you guys again.